Well, good afternoon, one and all, to the joint agencies meeting for this afternoon or early evening, whichever how you ever want to look at it. So we'll go ahead and get started. I think we can do brief introductions, if you would, please. John Thomas, Iowa City.
Hello.
Cami Rasmussen, Solon.
Hello from Solon.
Louise Fromm, University Heights.
Thank you, Terry. I'm present.
Rod Sullivan.
Everybody.
Charlie Easton for the school system.
Good afternoon, everyone.
Sean Eyestone, Iowa City Community School District.
Hello, all.
Janice Weiner, Iowa City Council.
Hi.
Laura Burgess, Iowa City Council.
Hi, everyone.
Kelly Hayworth, Coralville City Administrator.
Hello there.
Brent Smith, somewhere in his car.
Good afternoon.
Pat Hayden, Board of Supervisors.
Hello, everyone.
Susan Mims, Iowa City Council.
Hello.
John Lundell, Coralville Mayor.
Still here.
Ryan Hyatt, North Liberty City Administrator.
Good afternoon.
Hi, Hun, did I say that correctly?
Very close.
Okay. Coralville Council, Jeff Froon, Iowa City
Hello.
Administrator. Mark Nolte, Bruce Teague, Mayor of Iowa City. Donna Brooks. Who are you with, Donna? Marlene Mendoza.
That's correct.
Laura Goodrich, Coralville City Council.
I'm here. Hello.
Thank you. Katie Beischler. Did I say that right?
It's Beekler, but yes, I'm here.
All right, well, thank you. And Emily Sinwell.
Yes, hello.
Okay, and looking at the board here, see who may I missed. Sam Jarvis is with us.
Afternoon, everyone.
Manny Galvez.
Yes, I'm here.
Julie Johnson.
Yep, I'm here.
David Goodner.
Here.
Chris Taylor.
I'm here.
Matt Miller. Doug Bolt.
Yep, here.
Rakisha Harrington.
Yes, here.
Thank you. Rakisha Harrington, North Liberty Council. Ellen Habel.
Hello, Mayor.
Hi. And I think I got everybody that's on my screen. If I haven't, please holler. So we'll go ahead and get started. Item 3A. Item brought up by North Liberty was spring and summer park and recreation programming and implementation. And I want to also add into that the library as well, as are folks starting their programs in-house and on the fields soon? Or if not, are you holding off to a particular date? Or what is your feeling, or what are you doing here in the near future? Bruce, I'm going to pick on you. You know what your park and rec, what your rules are going to be?
Hello, and great to be here. Actually, I'm going to have our city manager, Jeff Fruin, just chime in so he can give a little bit more of a comprehensive of what we're doing right now.
Thank you. Jeff.
Yep, I'm going to punt again. Julie Johnson, our Parks and Rec Director's on. So over to you, Julie.
I will take it. Hi, everyone. Julie Seidel Johnson, Parks and Rec Director. What are we doing? Right now, our Mercer Scanlon facility is open for limited use. We have reservation only, lap swim, open swim, water walking, aqua fitness classes, some swim lessons starting very soon. And then gym and meeting room use also by reservation only. Their Robert A. Lee Rec Center is not open at this point. It's been a warming shelter through the winter. Probably not going to open till early June for any kind of public use, except some of the, we have a blood drive and some other recreation events may be happening before that. Our recreation programs for the spring and summer are largely based outdoors. So they will be small group sports classes, ecological classes, those kind of things happening outside in the parks with small groups, masks required. Sports are going, soccer, baseball, softball are all happening as normal on our fields. And City Park Pool, we plan to open this summer on a regular schedule. Limited capacity, but open. And our farmers market will start May 1st outside in the Chauncey Swan ramp. And new this year, we're partnering with Film Scene. We were going to start this week. We're going to wait till next week because of the predicted snow. But we'll have outdoor cinema in Chauncey Swan Park with a big screen up on the parking ramp there. So lots of exciting outdoor things happening, not much inside at this point.
Okay, thank you. Who can give me information about the Iowa City Library? Is that still closed yet, or you restricting the number of people or other special rules?
They are open right now for limited browsing. I believe it's 15 minutes at a time. And they will not fully open until the infection rate is a little bit lower. The bookmobile is also out and about at this point with free Wi-Fi and access to services that way.
Okay. Carlville, what about your sports programs and library? What are you doing there?
Yes, our recreation center is open and the indoor pool is open as well. We're doing lap swims during the specified times, and we're also offering swim lessons. We're taking registrations for the summer camp program, and right now we've got about 55 children each week for summer camp through the summer. We're also going to open our outdoor pool during the normal time after our June 1st approximately for that as well. So all of our sports activities, youth sports and adult softball is open. And then we are offering our partnership school locations for reserved use as well. So those are open as well.
Your library?
Library is almost exactly as Julie outlined as well.
Okay, good. So things are starting to loosen up. That's great to hear. Ryan, can you help me as far as the city of North Liberty? Okay.
Yes, I can. Yes, Mayor, I can. From a library standpoint, similar to what's been stated, we're opening up. We're open for appointments now, and hope to open that up probably June 1. Not full capacity, but offering a few more people that can get in there and browse. I don't think we're going to have a limitation on how long they can browse, but we'll be allowing folks in there. And then from a rec standpoint, again, kind of opening or turning that dial just a bit. We're right now, everything's by appointment. That's the lap swim, weight room, track, all that is by appointment. Also, gym space is by appointment as well. We are going to open up the pool. We're shooting for June 10th, I think, or June 12th, somewhere around in there. And that is when we open that up, it'll be at 25% capacity, which is about 125 people. So, and then we hope as the summer goes on, we can dial that up just a little bit more. So things are starting to come back, but as with the other cities, we're taking baby steps right now.
Any other cities or entities dealing with programs that are limited or soon to start?
I'll jump in and share Solon's plan right now. Our community center just closed as of the end of March, and we're focusing all of our resources outdoors. We have several programs starting up in the at the SRNA, the Solon Rec and Nature area. Our community center is available by appointment. The gym is available for rental, the batting cages, as well as just the facility for birthday parties and special occasions. We are starting to gain some interest in some of our adult programs. Our outdoor youth programs have been quite successful really since last fall. But interest in adult programs has been very limited, and we're just starting to gain some interest in that. So we know things are loosening up a bit. On the horizon to be open by June 30th. June 30th is the new Solon Splash Pad. It's right there at the trailhead of the North Shore Trail and the Hoover Trail. So we know that's going to be a great addition to trail riders. So again, our focus is to just keep things outside and safe. And then the community center will reopen in September. As far as the library goes, they are back to allowing afternoon open browsing. They are limiting the amount of people in the building and the time of browsing, but that's a great first step. It's been a long year.
Thank you. Any other entity? Well, all of you, thank you for your reports. It's really great to hear that things are opening up. We're getting the doors open, people involved, especially the young people. And it's just overall good to hear about and to see that we're all pretty much in the same boat as how we're handling things for. So thank you very much for that. Next item, COVID-19 vaccinations. I know that some of us put this one on. My particular idea or wanting to know is, what is it that the county and entities, whatever, schools, what can we do to help speed things up? And Sam, I'm hoping that you're in there pitching for us. And is there additional things that we can do to help things get better?
Yeah, absolutely, and I appreciate the question. I know that it looks like Mark Nolte is on after the vaccine update as well for promotional items too. So, but again, if I can give a quick update on the vaccine side of things, and then happy to discuss any disease questions as well. I know we're just kind of primarily focused on vaccine, but if there were questions about that, happy to answer them. But overall, again, the numbers off the site are there for those who are interested, but total doses administered in Johnson County are at 120,000, roughly. About 50,000 some folks have completed their series. So we're making really great progress. If you kind of look at vaccines by county residents and do a little math, as of to date, roughly 74,000 some folks have completed or started their series. And so presumably the persons who have started their series will likely finish and get their second dose. So that's 74,000 folks who are eligible, technically 16 and older. But if you take the population that's 18 and older, just for real quick math, and the 74,000 persons who have started or finished their vaccine series, as of today, that would be, within a month, roughly 62% of our population being vaccinated. So that's great progress. If you can remember and recall December 14th, 2020, when this vaccine campaign kicked off, we were starting to have a couple hundred, slowly 1,000 doses within the weeks coming. So we've made a lot of progress. And so a huge thanks to our partners at the hospitals, our pharmacy partners, New Cara, Towncrest, everyone, just for the immense amount of support and just heavy lift to do mass vaccination clinics, other clinics across the county, and going forward, even next week, there are 3 to 4 different clinics that are scheduled at varying times with Hy-Vee and we'll say the other CEPSN network pharmacies, which do include like Harding, New Cara, and Towncrest, getting a federal supply of doses and being able to do vaccines on site at their pharmacies. Then even other retail pharmacy programs like Costco and Walmart getting doses through sort of a different federal supply chain, we're doing very well. Last week we saw our largest weekly allocation from the state, which was roughly north of 6,000 doses. And so now we're approaching a point where providers are having appointments linger a little bit longer. Demand is still pretty high, but it's nowhere near what we were seeing in January and February. Every time we saw eligibility change, and then high demand happens right afterwards. So we're in a pretty good spot. Statewide, though, we are seeing appointments linger in some of the more rural parts in the western side of the state. Roughly, it sounds like last week the state reported to us 45 some counties had either returned or declined doses, receiving more doses than they had because they're meeting their demand. And so I think that roughly equated to 9,000 some extra doses that the state had to reallocate. So the great news is those doses are coming towards us in Johnson County and likely other larger population centers. And so we're continuing to work with partners here locally who believe that they can still get doses out the door and into arms quickly as possible. That 80% burn rate is still in effect. We are asking the state, and we know that they've asked the CDC and our federal partners to lessen that kind of penalty, that appearance, because many are seeing and noticing the slower demand. So in terms of kind of operations, again, smaller clinics happening throughout the county. Huge thanks to Johnson County Ambulance Service for helping us with persons who are homebound or persons experiencing homelessness. We've had a couple clinics, one at GuideLink. So a huge thanks to everyone there for having us hosting that clinic. So overall, really good progress and very, very happy to see. So going back to your question, what can we do more? Continue to encourage persons to get vaccinated. Share that within your social circles, your networks, continue to promote it. Assist others with access. If you know folks who aren't getting vaccinated or things, help them out. Ask them, do you need an appointment? Assist other community organizations who are doing that work. Because really, we've met the high demand or we're meeting it now. And so those last few percentages, it will either be access related, which we're working on with our partners, like UI Mobile and Free Medical Clinic. The other portion of that last few percentage points will also be hesitancy or vaccine confidence. So there's probably a good portion of folks who are in this wait and see kind of period. And we're hoping to convince them that the waiting is, please be done with waiting and get in line. And it's a shorter line now, so it should be less frustrating. So, haven't answered any questions.
Yeah, I've been reading that the amount of disinterest is rising in some areas. Are you seeing that happen here?
Not so much here, but that's the concern. We're looking at this last few percentages and wondering how to best assess who those folks are. I think there's a lot of good national and state kind of conversations where they're kind of pointing towards other groups and things. We've not come across that largely in this area, but we know that there are folks who are hesitant and they're probably seeking more information, or again, they're in that wait and see period. So.
You mind taking some questions? Questions for Sam? Oh, you're gonna let him off this easy?
Greatly appreciate that. No, any.
Well, thank you so much for your information, Sam.
Yeah, thank you for having us.
Item C, ideas to expand vaccine rollout in Johnson County. Mark Nolte.
Hi, everybody. So as part of Project Better Together, which many of you on here are part of, Dr. Rick Dobbins with the UIHC and Dr. Brian Kirschling with the Veterans Administration pulled together a group of people a few months ago and started talking about as the supply of vaccines came up, when we got to this point where we're at today, that we're going to need to do some marketing and some messaging to get over that hump. And we set a goal. We wanted Johnson County to be the leader in the state. We wanted to get above 80% of all adults vaccinated by July 4th. So that we could keep our economy open and growing and get back to having events. And so they've been working on that effort. And the goal is kind of over the next couple months, kind of May and June, run this like a political campaign. Daniel Wasta, who many of you know, who helped with the school bond campaign, is willing to help out for a few months. And we've reached out to the two political parties, the Johnson County Democrats and the Johnson County Republicans, about doing some phone banking. We distributed 10,000 buttons over the last couple weeks. Every city hall, every vaccine site should have received those. There's a series of videos that will be going out on social media. So if you haven't sent me a video of you encouraging people to get the shot, please do that. I think I mentioned the phone banking. We may do some more yard signs or some other radio spots, that sort of thing. But really what we're trying to do is amplify that public health message and have the private sector be supporting Sam and his team with public health. So we've had members from the University of Iowa College of Public Health helping with some of the messaging, and you'll see some of that go live here in the next few weeks. There'll be some signage that will go into businesses, especially retail-facing businesses, bars, restaurants, stores, that sort of thing. Just kind of encouraging people to work with their friends and family and neighbors to get the shot, overcome that hesitancy. And then the tagline for the whole thing, we just went with Johnson County Public Health message of "This is our shot, Johnson County." So look for more of that. We do need your influence. So if you would just take your phone and record a short video of why you got the vaccine, what your experience was like. Be candid. If you had some side effects, that's okay to talk about. We just need to keep chipping away at that hesitancy, and then just end with that tagline, "This is our shot, Johnson County." And Josh's team at Think Iowa City will then edit those down, and then they'll start to roll out on social media in May. We've been kind of waiting until the supply caught up with demand, but now we're worried that we're going to, as Sam mentioned, that we can't let supply outpace demand. So now's the time to really get to work on that messaging. So happy to answer any questions, but really want to praise the leadership of Dr. Dobbins and Dr. Kirschling on this.
Janice, could you hold up your pen that you had? Yeah, good.
And I want to thank the North Liberty Library is printing more of those right now. I got a message from them that they ran out, so they're working on more, and we can get more too. True Art, David Bywater's team made those for us, so we can get more of those anytime if we run out. But we thought they had more lasting. They would last longer than the stickers that people got. So encourage people to wear those as you go out and do your errands and stuff, because the more people see that, the more it'll chip away at their hesitancy.
Will you please give us the tagline again and an email address where it can be sent to, please?
Absolutely. So the tagline is "This is our shot, Johnson County," and just send it to markanolte@gmail.com.
Mark, are they planning any, in addition to phone banking, are they planning any events or safe door knocking or anything along that line to help distribute information or get the message out?
They had a meeting yesterday, and I think at this point they're not comfortable with door knocking. I think the goal is to kind of flex the campaign as we need, but there was a lot of hesitancy around door knocking right now, just because it's for some people a contentious issue, and then obviously the safety concerns going door to door. So I think that will be kind of in the back pocket if the numbers don't get there as kind of the last effort, but we're hoping with phone banking and some of the other efforts, we can get to that 80%.
I have a quick question for either Mark or Sam. Can everybody hear me?
Go ahead.
Yep. What do we tell people who got their first shot already, but are looking to get their second shot, and for some reason they either forget their appointment or they are elderly and their kids got so busy that they could not take them to their second appointment?
They can give us a call. I know that 211 was stood up as well, but we can certainly help assist and look at that going forward, whether their second dose or if they're looking for other clinics that are open. I know that now some clinics are starting to advertise that they'll take, if they're doing a first dose, that they'll take second doses as well too. So I know that initially on that was kind of confusing and pretty rigid for kind of the logistics reasons and everything, but we're seeing a lot of that soften up and encouraging that because we are still wanting to get doses into arms pretty quickly. So.
And is there a time limit between the first and the second dose for it to be effective, or will they get the protection the same?
Yep. So, depending on the product, it's either 21 days or 28 days, but I know that there's an upper limit as well. But if it's far beyond that, we're happy to talk with them and see and everything. But for the most part, I've not heard of any, let's say it's far beyond. It's not the end of the world, and there's no reason to restart the series, which is kind of a common misconception with some vaccines. So.
Thank you.
Mm-hmm.
Sam, where do we stand on Johnson & Johnson?
The pause is still going on right now. It sounded like in the national news, Dr. Fauci had mentioned that we might see that unpause this as early as this week. And so again, we'll be curious to see how that impacts vaccine confidence. Certainly, I think for the Johnson & Johnson product, there will be some concerns that will be hard to get rid of, but we hope that it doesn't impact uptake of Moderna or Pfizer. So really, it's kind of, I'd say like a waiting game and kind of understanding more what community concern is that we can address. If persons don't want Johnson & Johnson, that's quite all right. There'll be plenty of Moderna and Pfizer as well too. And so overall, it'll be nice to be able to provide that choice to folks now, especially that supply is not as constrained. Again, the vaccine is safe. That was paused for those concerns. It sounds like they are still reviewing that evidence, and we hope to learn more in the coming days.
Okay. Any final questions for Mark or Sam? Yeah, James.
One quick final question, which is, I know that Pfizer has tested theirs on the 12 to 15-year-old cohort. Do you have any sense of when that may be working its way through the FDA process?
We do not. I believe on last week's Project Better Together call, Dr. Dobbins had mentioned that it sounded like maybe later this summer potentially. That was the plans. I'm looking at Mark right now. Correct me if I'm mistaken, but we hope soon. I mean, sooner the better. But it would be wonderful to see that happen and then be able to get those vaccinations going before the next school year starts.
That's how I understand it too. That June, July, that those trials should be done, and we may have the opportunity to start vaccinating kids before fall school starts. But and then just on the event side too, I hope everyone knows the county has some micro grants available. So anyone that wants to do a small event with friends and neighbors or something like that, they've got some funds. You can order food, that sort of thing. Have a little picnic and talk to your friends and family about the vaccine. I think that's a really creative idea. And then Supervisor Porter has a big event on April 29th that she's tied into being able to start getting people vaccines. So I think that'll be phenomenal too. But I think that's what it's going to take is more of that hand-to-hand, person-to-person effort if we're going to reach those that are most hesitant or maybe lack access. But it's been incredible to see how many, transportation, all the things that are coming together to help people with the access piece.
Good. Any final questions?
Hey, this is Roy Sam Porter, and I just would like to let everybody know, if you don't know, that April 29th at the Johnson County Fairground, we will have a food distribution of 30-pound boxes of food along with the vaccination clinic in collaboration with the Johnson County Public Health. So if you know anybody that needs anything, please send them out there. We'll be out there from 3 p.m. to 6 p.m.
Very good. Thank you. Anything else on the subject? Okay. GuideLink Center update, Matt Miller.
Hey, good afternoon, everybody. How are you? I appreciate you having me on to give you guys an update on what's going on at GuideLink. I think several folks are very aware of what's happening and some not so much. So I'll just kind of try to paint some broad strokes. And if you guys have questions, please let me know. Our original intent with GuideLink was to open all of the services at full capacity at the same time. That's kind of where we were from a planning perspective. What we've come to find, though, is that several factors have led to us actually opening up with a phased approach. And we actually started then with crisis stabilization services on February 15th. So we've been open for crisis stabilization since February 15th. Currently, we're taking referrals from law enforcement and mobile crisis only. We haven't yet begun serving walk-ins, and the substance use services have not yet begun either. We're working on getting additional staff in place. Frankly, staffing is the biggest thing we're still trying to wrap up, along with some added safety and workflow protocols that we're writing before we open up to walk-ins. The goal is to have full services available, walk-ins, substance abuse, and everything by June 1st. Even before that, though, we're going to be opening up things quicker than that. Sobering unit in particular has been something we've been getting questions on. I think we'll be able to open up some version of that within the next couple weeks. And then we'll be working on, once again, offering detox and everything like that as well. Also expanding our capacity and adding crisis observation. We did have our first advisory board meeting on April 6th, and I believe the next one is scheduled for May 4th. So that's coming up here soon. We've got a lot of good input from that first meeting. A few statistics for you guys. Since our opening, as I mentioned on February 15th, we've had 58 admissions. Of those, it's been 50 different individuals. So 8 people actually have come back a second time. So we've had 58 admissions for a total of 50 different individuals coming through. As far as like law enforcement things go, we've had a total of 28 law enforcement referrals. As far as the breakdown by who's doing that, Iowa City PD, there's been 20, Coralville 1, Johnson County Sheriff's Office has had 4, and UIPD has sent 3 people our way. So there's some quick high-level statistics for you guys. Are there any questions for me on specifics?
Questions or comments to Matt? I'm just glad to see it open and functioning.
And once again, a big thank you to all of you guys for making that possible.
Anything else for Matt? Okay, moving on. American Rescue Plan Funds. This was put on by Iowa City.
Hi, I can start with this part. And first, I want to thank you for giving us the opportunity to talk about this important issue for thousands of residents in Johnson County. My name is Manny Galvez. I want to introduce myself. I live in North Liberty, but also I am part of Catholic workers. I am a Iowa City worker, but the most important, I am part of the Latino community. I mean, in this moment, and I want to talk about this proposal like we are doing. Several residents, several organizations, because first I want to say like we recognize all the efforts like many municipalities, many organizations in Johnson County they have done so far, especially during the pandemic time. However, I feel like we know everybody in this Zoom and this meeting, everybody knows like thousands of people in our county, hardly they receive like a stimulus check. Why? Because they don't have a legal status, and I think like it's unfair because we are here because thousands of workers that have been doing that have been working so hard during all this time, during like all these hard times, and many of these workers they don't have a document, so they didn't have access to many supports like maybe you or me we have access. And I want to say like most of these workers they are in the Latino community. And all this year, when I am sure like I am not the only one working with this community, and many can share my opinion when I say that many of these people, many of these families, they are struggling so much. And I hear many times how hard it was for them, just not because this is like a legal situation, but also because it's obvious that the Latino community, the Latino immigrant community is passing one of the most hardest times in this country, in our country, in America. Why? Because the political environment is totally against immigrants, especially the last 4 or 5 years. So after me, they're going to talk about more details, but hopefully you can like open you open your, to hear this proposal. But the most important, I hope you can open your heart, because I think that this is not just a political issue, just not an economic issue. It's a human issue. With this relief, recovery, and reparation fund, like we are proposing right now, is talking about that we are humans and we can offer some example. Iowa is the few states in the country that practically they didn't give some support to the Latino immigrants. I hear in Colorado, in Minnesota, California, New York. However, in Iowa, the political speech for the state level is against the Latino immigrants. So hopefully you can see that we can be an example in Iowa and send one message like this country, the foundation is from immigrants. And hopefully another counties, they can follow our example. And thank you. This is my part.
Thank you, Manny. I did want to just jump in. This is the agenda item that Iowa City put on the agenda, and it's about the American Rescue Plan funds. And so I'm going to ask for our Councilor Weiner to come and speak on this item.
Thank you. Yes.
Go ahead, please.
Thank you, Mayor Teagan. Thank you, Mayor. Essentially, I just wanted to put this out on the agenda because it strikes me that with the substantial funds coming in from the American Rescue Plan to Johnson County, to Iowa City, to North Liberty, Coralville, all the municipalities here, we really have a unique opportunity. We're still waiting, as I understand it, we're still awaiting guidelines from the federal government on what these funds will be able to be spent on. But I just wanted to throw out the idea that this might be an opportunity to consider how and under what auspices we could put together a task force with multiple stakeholders at the table, so that we can really get all ideas out, avoid overlapping and duplicating ideas, and create multipliers, so that 5 or 10 years from now, we can all look back and say, this was really transformational and we accomplished something really important for our communities together by actually all sitting down at the table together.
Thank you, Janice. Bruce, did you want to add anything else?
Mayor Donahue?
Yes.
Oh, I'm sorry, Bruce.
Go right ahead, please.
Mayor Donahue, this is Charlie Eastham with the Iowa City Community School District Board of Education. I'm also a member of the Center for Worker Justice, and as a member of the center, I'm the representative from the Center for Worker Justice to the Johnson County Interfaith Coalition. I just wanted to bring to this group that, especially people from Iowa City, that JKIC will be making a presentation to you several times probably at your meeting tomorrow night. And our basic request is going to be that at least Iowa City, and I would direct this to representatives from Johnson County too, that you include at this point representatives, as Janice and Manny I think have said, representatives from low-income communities and representatives from local organizations like the Catholic Worker House that are dealing with the effects of the pandemic on people in the community that have been most adversely affected. So again, that'll be coming up at your meeting tomorrow night. And I hope from a school board perspective, at least my perspective as a single member, that you'll take that request up and act on it. As you know, the school district has been working hard to continue our educational efforts in an effective way with all students in the district. And that has not been necessarily successful, especially for students of color and for students of lower income, lower SES. So in my view, focusing on people in the community, as Manny had described, and Janice, that have been most affected by the pandemic is how we should be considering and directing these federal dollars.
Thank you, sir.
Mayor T, can I add something to the conversation?
Please.
Okay. Hi, everyone. I hope you all can hear me. I have a little bit of a lag. My name is Marlene Mendoza. I am currently the president of Council 308 for League of United Latin American Cities, or LULAC, which is based in Iowa City. I just wanted to add on to what has already been mentioned by Charlie through the Center for Workers' Justice, Manny just as a general big advocate for low-income communities and the Latino community in the area, and same to Janice. And what I just want to add is, aside from opening your heart, we have to really look at this through an economic perspective. Just like we have offered vaccines to everyone, regardless of their status, of who they are, just to make sure that the larger community is safe. And also to target the people who are mostly impacted by this, we should really approach how we distribute these funds from the American Rescue Plan in that same manner. There's a lot of families who have mixed status, right? So a lot of their kids are citizens, and they did not benefit from the stimulus checks or any other things that in the last 4 years have been ripped away from their safety net, I guess you could call, including back then when we were talking about blanking out on the term, on the thing that it was in regards to cuts to food stamps. I'm blanking out on it right now. But to the point, I'm very happy to engage Council 308 or LULAC in Johnson County. We have various councils in the county at the county level to talk about a task force to really figure out ways to bring in ideas, but also help with the distribution. In between all of us, from the Catholic Workers to the Center for Workers' Justice and even LULAC, we have identified a lot of these families because they have come to us as the last resort. And a lot of our organizations, with the small funding that we have, I mean, LULAC, we don't get paid for this. This is completely volunteer work. And it's been really hard for us to try to do what we can with the limited resources that we have. And then lastly, this direct surge in help has resulted in organizations that have been brought up in the height of the pandemic, like Open Heartland, which is one of our key partners that LULAC has been working on. But again, no community, small programming can really help us get out of this hole that we have in helping the community. And this is building off of the disaster of the derecho that first happened, that knocked out a lot of these families. And then it was the added pandemic. So I'm happy to be in conversations, Janice and anyone else in the table, to talk about how we can figure out different ideas and ways to help out all communities.
Mayor Donahue, could I add something?
Certainly.
Janice, I am very much in favor of your suggestion. I wanted to kind of get the sense of what people were thinking. I wonder if we should go ahead and request each city that's interested appoint maybe a staff person and an elected to some kind of committee, and just start right from the beginning with a committee in place. It seems to me if it's just elected officials, they may not know the necessary detail, but if it's just staff, we may not get the political piece in there. I wonder if we need both.
Mayor Donahue, could I
please, Katie.
Thank you. I like Rod's idea. First off, I also think public hearings are a really important part of this. It's important to get elected officials and staff on board, but also I think we need to hear from a broader public about what people are actually experiencing in their real lives and how they can be helped. We provided a letter this morning to Tracy, so hopefully there's a way for the letter to have been or to be disseminated to all of you. But there's a coalition of groups who put together a proposal that I'd just like to go over some of the highlights of quickly as sort of a proposal to you all to think about as we look at the amount of money that we have coming into us and the significant opportunity that it gives us. So we know that local and county governments can use the funds specifically for providing aid to workers and families, small businesses, nonprofits, and other impacted areas. I would like to note that businesses have received throughout the last year and will continue to receive aid through other relief programs. So it's important that we think about working families as we talk about these funds. The coalition that we put together, our guiding principles on how COVID relief money should be spent, included public money should be spent on the common good with a preferential option for the poor, and relief aid should go directly to essential and excluded workers most impacted by the pandemic, and those workers should also be impacted by any infrastructure that we put in place. As a coalition, we demand that Johnson County, Iowa City, and other county municipalities spend the more than $47 million in COVID-19 relief aid in the following 4 ways. $20 million for an excluded workers fund to provide more than 6,000 undocumented excluded workers and previously incarcerated people with a portion of the economic stimulus, enhanced unemployment insurance, derecho disaster relief, and other reparations they never received. This proposal is modeled after a recently passed state law in New York, the first of its kind in the country. Grassroots groups with membership bases in the impacted communities must be able to oversee the distribution of aid, and this aid should not include burdensome paperwork requirements like proof of financial impact, loss of income, or back payments owed. This would be up to $3,200 per person, including children. The second way it can be used would be $20 million in hazard pay raises for the more than 12,000 public employees, school and hospital workers on the front lines of the pandemic. An average of $1,600 more per worker per year, or nearly $150 in additional income per month. I work for SEIU Local 199. We represent support staff at local public schools, and the healthcare staff at UIHC. So this is incredibly important to the folks that we represent. The third way is $5 million on 54 new community-controlled affordable housing and housing cooperative units for undocumented workers, previously incarcerated people, and refugee resettlements, collectively owned and managed by a housing cooperative and community land trust, because Governor Reynolds is wrong. Caring for migrant children is a responsibility, and we should welcome them in Iowa. And finally, $2 million for public transportation and Sunday bus service, expanding access to the city to everyone 7 days a week. This coalition included groups including SEIU Local 199 that I work for, Iowa Citizens for Community Improvement, Iowa City Catholic Worker, AFSCME Local 12, Iowa Freedom Riders, and LULAC Council 308. And again, I would like to highlight public hearings should be a part of this process. Thank you.
Thank you. Bruce, anything more that you wanted to add?
Can I go back?
Okay, right.
Terry, because nobody, we didn't get any discussion there on my comment, but do folks think that some kind of standing committee is a good idea, or you want to wait on that? Or I'm just curious what the other electeds think.
Okay, in my particular stance, our council has no knowledge of this whatsoever. And I'd like to get that information that was just received today out to them and start getting some feedback from them before I really commit to anything.
Makes good sense.
Terry, or Mayor, could I
Yes.
say something? I'm on the committee at the county for creating guidelines for the how these monies will be spent. And while I certainly can respect the need out there, to make demands is really just not part of this, because there's a huge piece of this, the compliance piece, and any subrecipients are going to have to be able to either kind of help us to help them with that compliance piece, or be able to provide it themselves, because if they don't hit all of the things that are federal regulations, and we don't know what all of those are yet, the money will have to be returned. So I think that we need to walk carefully in stating things in kind of a demand format. Furthermore, I think that one of the things that we were going to be doing at the county, and Donna Brooks, our grants coordinator, can perhaps maybe Donna, don't mean to put you on the spot, but speak to this, but as we learn more, we wanted to connect with all of the other entities so that for the very things that were already mentioned, so that we don't duplicate some of those services. Some of you might have been on that legislative call regarding what some of the state monies were going to be focused on. And so we certainly don't want to do those same things. So obviously good communication and coordination, and that everyone coming to the table, as Janice mentioned, is absolutely a good idea. But we have to keep in mind that we can't just start handing out money without there being follow-up paperwork, like it or not, and doing the compliance pieces of that. So yeah, now I'm probably really unpopular, but those are the details that do have to come with grant money.
Right. And I would just like to make a quick comment about that, Lisa. Thank you for bringing it up. And I think as units of local government, we all experience some of the frustrations that followed the CARES Act. And inclusivity was a major problem. I mean, we saw what happens when you move resources quickly through existing systems, and absolutely it can exacerbate economic and racial inequality because we have people who are struggling to have access. And through the American Rescue Plan Act, there's actually going to be provided funding for community navigators. And these roles will hopefully be utilized, and this funding can be utilized to help ensure some of the equitable access that's been talked about this evening. But I mean, I think we're just, you know, Rod's absolutely right. There should also be some regional recovery council or some type of collective joint entity that navigates this together as the guidance from the U.S. Treasury is released. And we ensure that these funds are utilized in our communities for, you know, long-term impacts and investments and not just brief economic stimulus. So I look forward to working with any entity and to continue to work at the county level to make sure that these issues are addressed and that we do it in a collaborative and compliant manner.
Thank you for your comments. Bruce?
Yeah, I'm going to keep my comments short because I think a lot of people touched on at least the mere essence of what I wanted to say. My comments was really related to the importance of really looking at the needs within our community collectively. And I think that what Councilman Weiner mentioned is if we all came to the table to identify what the challenges are, we'll certainly look at what some of the rules are, because Lisa Green Douglas, she's exactly correct. We have to look at that. But I also believe that when we look at the funding that has been given to our business communities, even though there is still need there, we also have to look at our individuals that are within our community. Some of the programs that we're going to get federally will be limited. Absolutely. Some of the state programs are limited individually. And I think identifying what, you know, where the lacks are for individuals, of course, each entity has to do that for themselves, but maybe there is a collective opportunity that could arise from this. And so I know that for the, you know, the benefit of this meeting, it would be nice to find out who would be interested. But I think at this point, if we can potentially maybe send out an invite, I guess, if people are kind of open to it. We understand there'll be some literature submitted by the individuals that presented today. But I think the bigger opportunity that we have is to come together as a collective body while really listening to and hearing the needs of the community.
Other comments?
Terry, this is Charlie.
Go ahead. I was just going to say real briefly that I really do like your idea, Rod. I think that would be a good start.
All right, so this is Charlie Eastham again. And Rod, I would support your idea too as a school board member. Hopefully the school board would also be involved in some degree in these deliberations. And I would also comment as a member of the Center for Justice, I think CWJ and all the other entities, nonprofits that have been involved in direct payments to individuals have figured out compliance by now. In fact, I think we're pretty darn good at it. So I don't think that's going to be an issue, really.
This is David with the Catholic Worker. It's actually been a major issue, compliance. And I don't agree that we need to be preemptively handcuffing ourselves about how aid is delivered by saying that we're going to be forced to comply with, paperwork requirements and things like that. The city and county government have all the discretion in the world to make those decisions and to work with groups like ours to make sure that the money is given to the people who need it without any strings attached, period.
Thank you for your comments.
I'll just say Coralville is much like your city, Mayor Donahue. We haven't had any discussions and would certainly want to wait and see what the regulations and guidelines are before we would move forward with anything.
Thank you, John. Any other comments?
This is Roy Sam Porter speaking.
Yes.
And, I'm looking forward to sitting down at the table, speaking with people, trying to see where the need is in our community. But as a joint entity meeting, sitting here listening to this, listening to people come on to this meeting, telling us or demanding that we do something, and how you really, like David Goodner just spoke, stating you have discretion. No, there is rules and regulations that have to be followed as far as this money goes. So if you really want this money and you want help, I just want to tell people to stop making demands and let's sit down and let's talk. I'm sick of all the demands. It's been going on all summer long. Let's just come to the table, sit down, and let's talk. Because you making demands don't mean anything. It's not going to make anybody move any different. If you just willing, if we know who needs what, be willing to come sit down at the table instead of making demands. That's all I got to say.
Well,
thank you,
Dan.
What you say, Pauline?
I said, well said.
So what is the next? So and that's great. I'm happy that people are willing to come to the table and have that discussion. I believe in that being a good strategy. But what is the next step to make sure that it starts, being carried out, right? To make sure that we start having this conversation so that we don't delay ourselves in making sure that we know how to be able to distribute these funds with compliance and everything that has to be in order.
Well, I know for us, I have to get to my council with the information and things that have been said this evening. At the same time, as Lisa said, we don't know all the rules of the ball game yet. Until you really know the rules of the ball game, can you make substantial decisions? I think once that we as city officials, county officials, school officials know what it is, I know that this group is strong enough that we can call each other and say, is it time? Are we ready to move on this thing? Can we go with it? And then sit down for a meaningful discussion. We fully understand, but not understand what's being asked for here. We may not be able to do all of it, but with our individual communities, there are those set needs in those communities as well. So that's basically where I'm putting things at right now. Okay. If you want to, general entity updates, if you want to pass on that this evening, it's not going to hurt my feelings none. Next meeting date and time. I have no idea whose turn it is.
I do.
Yay!
It should be Iowa City School District's turn to host.
I had mentioned that exact thing when I spoke to the superintendent yesterday. I said, it's probably about our turn. And do you want me to volunteer? And he said, sure, go for it. So yep. I was
volunteered.
Fully expecting it.
And the date should be Monday, July 19th.
Got that, Sean?
Yep.
Okay.
Thanks, Tracy.
She's a
I have to give
lifesaver.
credit where credit is due. It's Kelly from Iowa City took care of me.
Okay.
Any other business? If not, folks, have a good evening and good rest of the week and hope we don't get any snow.